Welcome to the Burnaid channel. Thank you for joining us. Today, we'll be discussing a nursing care plan for the risk of infection. Infection risk is a common concern for patients with compromised immune systems, post-surgical patients, and those with chronic conditions. In this presentation, we'll cover assessment, interventions, desired outcomes, and evaluation to effectively manage and minimize the risk of infection. Understanding the risk of infection. One definition: risk of infection refers to the potential for invasion of the body by pathogenic organisms, leading to illness. Two causes. Common causes include surgical wounds, invasive devices, immunosuppression, and poor hygiene. 3 symptoms. Early signs may include redness, swelling, fever, and increased white blood cell count. 4 importance. Preventing infection is crucial to avoid complications, prolong hospital stays, and improve patient outcomes. Nursing assessment. For risk of infection. 1. Health history. Review the patient's medical history for factors that increase the risk of infection, such as diabetes, recent surgery, or immunosuppressive therapy. 2. Physical assessment. Inspect for signs of infection such as redness, warmth, swelling, and discharge from wounds or surgical sites. 3. Laboratory data. Monitor white blood cell count, culture results, and other relevant lab values to detect early signs of infection. 4. Environmental factors. Assess the patient's environment for cleanliness, hand hygiene practices, and the presence of invasive devices. Nursing diagnosis. For risk of infection. 1. Risk of infection, related to invasive procedures, compromised immune system, or environmental exposure, as evidenced by the presence of risk factors such as surgical wounds or invasive devices. 2. Impaired skin integrity, related to surgical wounds, pressure ulcers, or abrasions, which increase susceptibility to infection. 3. Deficient knowledge, related to a lack of information about infection prevention measures, increasing the risk of exposure. Desired outcomes. For risk of infection. 1. Absence of infection. The patient will remain free from signs and symptoms of infection throughout the hospital stay. 2. Effective prevention. The patient will demonstrate effective infection prevention techniques, including proper hand hygiene and wound care. 3. Knowledge retention. The patient and family will verbalize understanding of infection prevention strategies. 4. Timely intervention. Any early signs of infection will be identified and treated promptly to prevent progression. Nursing interventions. For risk of infection. 1. Hand hygiene. Emphasize the importance of regular hand washing for both healthcare providers and the patient. 2. Aseptic technique. Ensure that all invasive procedures are performed using strict aseptic technique to prevent contamination. 3. Wound care. Perform wound care as prescribed, using sterile techniques to prevent infection. 4. Patient education. Educate the patient and family on infection prevention measures, including proper hand hygiene, wound care, and recognizing early signs of infection. Nursing interventions. For risk of infection. Part 2. 1. Monitor vital signs. Regularly check temperature, heart rate, and respiratory rate, as changes may indicate the onset of infection. 2. Use of PPE. Ensure the use of personal protective equipment, PPE, by all healthcare workers to prevent the spread of infection. 3. Isolation precautions. Implement isolation precautions if the patient has a known or suspected infectious condition. For environmental cleanliness, maintain a clean and sanitized patient environment to reduce the risk of pathogen exposure. Evaluation of nursing care. 1. Infection status. Regularly assess for the absence of infection, ensuring that preventive measures are effective. 2. Patient compliance. Evaluate the patient's compliance with infection prevention strategies, such as hand hygiene and wound care. 3. Response to treatment. Assess the effectiveness of interventions if signs of infection develop, ensuring timely treatment. 4. Patient understanding. Confirm that the patient and family have a clear understanding of how to prevent infections both in the hospital and at home. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.